What is idiopathic scoliosis? Idiopathic scoliosis means a scoliosis of the spine for which there is no medical reason underlying. Basically, normally the spine is straight like this, but when it bends to one of the directions, say right or left, then it is called as scoliosis. So in simple sense, the sideways curvature of the spine is known as scoliosis. So in idiopathic scoliosis, this is more common in females as compared to males. The spinal curvature starts bending to one side as the age progresses, and slowly it can become very severe. If the case is very severe, it can cause respiratory problem or abdominal problem because of the curvature of the spine. In idiopathic scoliosis, normally there is no underlying reason. And as the child grows, the curve starts to increase. There are two main growth spurts in this case. One is between the age of 3 to 5 and one is after the age of 10 years. In females, it is between the age of 11 years to 13 years. And in males, it is between the ages of 13 years to 16 years. The treatment of idiopathic scoliosis depends on the curve magnitude as well as the age of the child. Normally, if the curve is less than 40 degree, it can be managed with brace and exercises. However, once the curve reaches above the 40 degree level, then we need to do some sort of correction. So if the child is young, say between the age of 5 to 10 years, we normally do a temporary non-fusion procedure, which is known as a growing rod procedure. In this, we put screws at the top and the bottom level of the curve. We put a rod and straighten the spine. In this situation, we do the surgery every 6 months. We keep on elongating the spine so that the height of the child also keeps on growing and the curve also remains straight. Ultimately, when the child reaches the age of say 10 years, we do the final fixation procedure in which we put multiple screws in the spinal vertebrae. We put a rod and we do a corrective osteotomy. Now the corrective osteotomy can be a small osteotomy known as Ponti's osteotomy, or it can be a bigger osteotomy involving the bone in the front, which is known as the vertebral body, in which we take out a triangle and we correct the spine. So we put screws, we do osteotomies, and we correct the curvature of the spine. The child becomes straight again, and this is the permanent correction for the child. After this, the child has to wear braces for a few months and then he can be back to his normal life. Normally, in all of our surgery cases, wherever we have a complex case like scoliosis, we use 3D navigational technology, which gives us almost 99% accuracy in placing the implants within the spine. And we use neuromonitoring in all the cases, which gives us accuracy, or which gives us the possibility of monitoring all the nerves during the surgery, so that the chances of paralysis or any sort of complication becomes very less. So if you are suffering from scoliosis, you can forward us your images both for the X-ray and the MRI on the number shown below, and we'll be happy to help you. Thank you. अगर आपको हमारा ये वीडियो पसंद आया तो हमारे चैनल को सब्सक्राइब करना ना भूलें और ज़्यादा से ज़्यादा शेयर करें.